To understand what CardioMEMS is about is, first of all, you need to understand what heart failure does. So when you have lost the ability to actively relax and contract your heart muscle, you're going to have symptoms of shortness of breath. What was previously accustomed for you, like climbing a couple flight of stairs, you'll not be able to do it. And based upon the intensity of decrease in your exercise capacity, the New York Heart Classification classifies that as class 1, 2, and 3, and 4. With class 1, you get short of breath with unaccustomed exercise. With class 4, you're short of breath at rest. The location of the hospital is such that our highest number of patients that get admitted with heart failure is the highest around. This is because of higher prevalence of hypertension and end-stage renal disease in and around our hospital. This CardioMEMS is a small device that is implanted through the femoral route into the posterior aspect of the left lower lung. So it monitors the pressure inside the lungs and is a surrogate for the volume status within the heart. And if the patient goes into heart failure before they have manifested symptoms of heart failure, you're able to adjust the diuretic therapy and keep them out of the hospital. If a patient is scheduled to undergo a CardioMEMS device, they need to come fasting overnight to the hospital. The patient lies flat on the table. He gets IV sedation. We access the femoral vein. Then we pass a pressure catheter inside the lung. We try to go to the left lower aspect of the lung and the posterior part. That means in the back over here. We shoot a venogram in which we define how much the blood vessel size is. And then after that, we pass this device into that location and we deploy the device after making sure that it's communicating with the outside monitor. Once that is in place, we get everything out except that little device that stays inside the body. Then we again shoot pressure and cardiac output inside the lung, and then once we have the data, the procedure is closed. The actual procedure lasts about 30 to 35 minutes. Morbidity and mortality associated with the procedure is negligible, and the patient is on his feet in 4 hours' time. What you're going to expect as a patient is improvement in quality of life and decrease in hospital admission rates, and possibly decrease in mortality. That means the risk of dying goes down. The risk of developing symptoms of shortness of breath, waking up at night because of shortness of breath, swelling of feet is going to go down. The chances of getting admitted to the hospital as a result of heart failure worsening is going to go down. So it'll benefit immensely.